healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinx Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Hi, everyone, and welcome to another episode. As usual, I'm your host, Stuart Newsome, and we've got a great conversation ahead as we explore the real-world story of how Chesapeake Medical Imaging transitioned from manual fax-based workflows to a fully integrated automated system that streamlines order intake and prior authorizations. So this episode is called From Paper to Precision, How CMI Modernized Imaging Orders and Prior Auth. And it's exactly that, a case study in how one team tackled inefficiencies, modernized their workflow, and delivered better outcomes for patients and providers alike. So let me introduce today's panelists. As typically we have one guest, maybe two guests we'll have sometimes, but this is going to actually be a full panel. First of all, we have Christine Stokes, who's the X-ray Department Manager at Chesapeake Medical Imaging, also the ERAD Administrator and Global Project Manager. We have Tom Marshall, Chief Marketing and Business Development Officer at Chesapeake Medical Imaging. We have Jason Kerrigan, who's the VP of Sales and Customer Success at ScriptSender. And then we have Stephanie Chang, our own Associate Director of Client Success here at Infinx Health. So thank all of you for joining. Great for having you here. How is everybody doing?
Wonderful. Thank you.
Doing great.
Awesome.
Thank you.
Awesome. Thank you.
Well, here's what we're going to unpack today. I always like to give people some insight on what we're going to talk about before we talk about it. So we'll start with what operations or CMI looked like before the transformation, kind of a little snapshot of the before, so to speak, the breaking point that triggered the need for change. Then we'll walk through how the integration between ScriptSender, Infinx, as well as CMI's risk system works in real time. From there, we'll explore the impact, how much has changed in terms of staff efficiency, patient access, prior auth success rates. And finally, we'll talk about what made this partnership work and the advice for others considering a very similar move. So we've got a lot of ground to cover. So we're going to dive right in so we can fit all this in to at least 30 to 45 minutes. So I'm going to start with Tom. It's going to get us started. Can you give us, say, a quick snapshot of Chesapeake, who you serve, what operations look like before 2021?
Absolutely. Yeah. And Stuart, thank you for having us. And we're excited to kind of share our CMI story. And before we kind of dive into the operational pieces of it, I think it's important to maybe just take a very brief walk in history of how CMI evolved. And Chesapeake Medical Imaging launched with the vision of our owner and medical director, Dr. Mark Begantz, with one open MRI machine back in 2001. And as time has evolved, 24 years later, we have 12 locations across Maryland. We have 19 radiologists, and we have an array of options now, which wasn't the case back in the day. So as we started with one location, we had a kind of a decentralized organization. We had kind of a homegrown RIS PAC system. And for many, many years, that checked the mail, that fit the need of Chesapeake and the referring offices. As time has gone on and there was the evolution of EMR systems, we really felt the need around that 2020, 2021 year that we needed to kind of graduate and evolve because our company was solely reliant on a fax and a fax document, whether it was requests for scripts coming in or reports going out. And that was really impacting us as we were looking at our competitors and hospital systems that were fully, integrating. And we needed to find a solution that would allow us to be nimble and from a cost-effective standpoint to be able to work with the 10,000 providers that we work with on an annual basis. So in saying that, we were able to find a couple of solutions and couldn't be happier to partner with the ScriptSender and Infinx. And from an operational standpoint, this is where I'll kick it over to Kristen to explain just how we were ingesting, orders, sending reports out. And then from a pre-auth standpoint, just kind of the manual process that took that really put us behind the eight ball. And now we feel like we're truly ahead of the curve. So Kristen, take it away with the operational pieces.
Yeah, absolutely. Thanks, Tom. We're excited to be here and to explain our journey to you through ScriptSender and Infinx. So the way that we started with orders, we would receive paper documents either being faxed, emailed, or patients bringing them in. And then you would have the manual process of entering that order into our RIS system to create that electronic order. And then for the pre-auth department, we were waiting to schedule patients until authorization was obtained. We then would wait several days for the authorization to be able to even provide the patient with a scheduled date. And then from the report standpoint, again, we relied on fax heavily for the report to get over to the provider's office via fax. You always have the barriers of having the correct fax number or providers' offices having different fax numbers. Well, I want you to fax request here, but I want my reports to go here. So now jumping into where we are now, we have 40% of our orders are received electronically. When we receive those orders from the provider's EMR systems, they generate an electronic order into our RIS system, and the authorization is started as soon as the order is placed. And then as far as reports, the reports also go out electronically, and you can set up notifications so that providers can be made aware that they received those reports. So again, now that we've jumped forward, we're in this, we're seeing 40% of our patient ordering volume is all electronic. So that means our scheduling, our front desk does not have to place the orders manually. Everything is done electronically. Our pre-auth department relies heavily on Infinx with the orders to obtain the authorizations for us. So our pre-auth team isn't on the phone with the insurance companies for those hours at a time, waiting and trying to get the authorization. Infinx has taken that on for us, and it's really allowed us to kind of shift in what our staff is able to do now, and the patient access is higher. So Jason, I can turn it over to you if you want to comment on any of that as well.
I mean, I absolutely could piggyback off you if we're ready for that right now. So you tell me.
Yeah,
so
I think it's been like a huge plus for us for
Yeah.
sure.
Yeah, well, let's just piggyback right off that. I think it's great. So I'll dive in a little bit further about what we kind of have done at this point, right? So ScriptSender connects directly into CMI's RIS through a secure integration, right? Which really streamlines the whole entire order intake process, right? Which is the biggest thing. With our print solution, which everybody's talking about right now, referring providers just print the order from their EMR, exactly like they would if they were sending via fax, right? But instead of creating a paper or digital fax, ScriptSender turns it into a fully electronic order that bypasses faxes altogether. So from there, we automatically pull all the key data elements. Let's just talk about like patient demographics, let's say insurance info, CPT codes, referring provider data, right? And format it into HL7 that is, in a feed downstream. And then from there, ScriptSender checks whether the exam requires prior authorization, right? If it does, we kick off the process with Infinix right away through a secure API connection. There is no manual work now at this point. You know what I mean? There's no printing, faxing, or uploading anything. As soon as the referrings order is created, Infinix gets the full digital payload and can start working on the case immediately at that point in time. The whole thing is seamless. It eliminates all the back and forth delays that typically slow down, and it helps CMI get the patient scheduled faster at that point in time, with the confidence that prior authorization is already moving forward. And at the same time, sometimes before the staff even knows that it's actually happening, because it's already happening in the background at that point in time. So that's kind of like the whole streamlined process of everything that we're doing with our product being able to integrate with Infinix at that point in time as well. And we've been partnered and working with CMI for quite a long time at this point in time. So with everything that we're doing, it's all pretty much automation is what we're trying to get at this point.
Awesome. So, and Christine, I want to kind of come back to that and with Jason describing that integration and everything working in the background. So what did this integration look like for your team specifically, especially shifting from that manual process to this auto ingested of orders?
Yeah, I mean, it was definitely a process because you're taking all of the old workflows that you're so used to doing and trying to move forward with an electronic approach. So it was very seamless. And working with Jason and working with Stephanie, they any questions or concerns that we had, they were always readily available to help guide us in the right direction. And then they have engineers that are constantly working on things to make the product more positive for us, to kind of encompass our workflows and things that we do with our providers.
We keep it very customizable and we're very agnostic. And I think it's the same thing with Infinix at that point in time too, right?
Right.
So if there are, avenues or changes that they need to make at any point in time, having those conversations to be able to make sure that those workflows are taken care of is what we do.
So Tom, I know you mentioned in our prep, for this panel that seeing is believing, so was really a big theme for adoption
Mhm.
within CMI. So can you share how what you termed real-time demos helped your team and refers buy into this whole new concept?
Sure, sure. Yeah, so we have a dedicated team of physician liaisons that go out into the field and engage with the referring community. And I think we've probably all heard sales pitches before of like, we got a great product, like you should see this. And you're like, well, show me. And you're like, well, I can't show it to you right now. It's not ready yet. But with ScriptSender, we spent a lot of time with Jason to be able to articulate and explain how the product works. So when we go out to a referring office and we have a conversation, we can show this demo real time. We can sign up offices or practices real time. So when you think of kind of a traditional HL7 interface, which is still relevant out there in the marketplace, you are talking months and months of meetings and project management, and the financial component is huge. Here we're able to have some transparency with the visibility of placing an order. Under the document management tab, you see that order is sent real time. And then if there's any pre-authorization notes, you can see that real time as well. So we're able to do kind of a demo to launch in 5 to 10 minutes. So when you think of the months of potential integration meetings, we're able to demo it, launch real time, and then they're able to start seeing that impact immediately. So that's where the kind of seeing is believing narrative came from, where offices give us just incredible feedback where this is completely changed the game for them, and it's changed the game for us, where we have ballpark 140, 150 practices signed up now leveraging this.
Wow, that's very nice.
Yep.
So, Stephanie, I know you have a lot of experience, working with radiology groups, and many of them are still in this early stage of this journey, So in working with CMI and Jason and ScriptSender, what stood out to you about how this integration was approached?
Yeah, like Kristen said, right? There was a lot of manual efforts coming in from like a fax machine and then digitalizing the whole entire process with ScriptSender. I think all of this, first of all, thank you for the partnership with ScriptSender. We were able to pre-bake this integration workflow. We knew what data we needed to make a pre-auth successful. Let's start there as well. And then with that being said, it was already pre-built. And then in terms of customization, configurations, our backend team work hand in hand with this partnership. So working with the imaging center, like being vocal about, what's working, what's not working, what needs to be tweaked so that we understand how to build those customizations, or is it even applicable for the rest of the users that, we have outside of Chesapeake Imaging. So that's some of the things that we'd like to do. And then of course, just be ready for change and just be very vocal and just be open and minded about those changes.
Yeah, and to piggyback off of Stephanie real quickly, right? The partnership is huge because being nimble to be able to do specific things, to be able to ingest information, to be able to process specific things, to be able to understand the elements of what our customer needs, being CMI at that point, right? So that collaboration was huge, to be able to have those data points going back and forth so that they could receive what they're using and needing at that point in time to really automate those processes. And I keep going back to that because we're really trying to streamline workflows at that point, right? So it's been amazing right from the get-go. I think that without that, I think there would be a whole different ball of wax that people are dealing with at this point in time, which would be a lot more difficult to deal with because, again, we're going to go right back to that manual process, or it's going to be multiple people being involved, right, with a huge staff that's, going to these RBMs at this point in time to be able to handle those specific things going back and forth. So I think this partnership is what really, kind of situates and pushes us forward.
Awesome. So, Tom, back to you. You've described prior auth as a race against time, and I couldn't agree more. What did that race look like before, and how does it look now?
Yeah, I mean, before it was just a very manual kind of snail's pace workflow that was really dependent on referring offices, completing, clinical notes and transcribing and faxing and going into a fax queue and our staff kind of sorting through, getting the queue, matching it up to the order. And I'll also note, here in Maryland, there's a lot of competition. And that's really kind of where the race against time is, where we're up against other private practice entities. We're up against large academic centers who offer their flavor of radiology. So when patients have a choice, they have a choice every single time a script is written. It's really a race against time for us to be able to, complete the prior authorization for the patient to get them the care that they need. So kind of a snail's pace to now the ability to send the order, the demographics, the insurance information, the clinical notes through ScriptSender that goes into our risk packs that's ingested into Infinx. We're taking potentially days down to hours, if not minutes, for every single patient that is sent to us. So it's been a huge just paradigm shift for prior authorization, specifically here at Chesapeake, considering there's insurance barriers that are constantly being presented on more and more cases being requested for prior authorization. So it's a race against time for us to be able to provide the care that our patients deserve. And these two companies have helped us do that.
Yeah, that's awesome. And Christine, what changes has your team experienced since the process became more automated? Now that you have a little time and mileage under your belt for this.
Yeah, absolutely. So if we shift back to when we were receiving faxes or paper copies of orders, we had individuals on site that were, had stacks 500 pages high of scripts, clinical notes, and none of our facilities were integrated together. You would have to call that facility and say, hey, did you get an order for such and such? Do you have clinical notes for such and such? Can you upload them? Now everything is in the same platform. So no matter if you call this office or that office, we're going to see all of the same information. When the orders come over electronically, we were able to build automated calls that go out to the patients telling them that we now have an order and getting them on the schedule as soon as we receive that order. As to whereas before, again, you had that stack of 5,000 papers, you didn't know who needed to schedule what. So it's way faster. We're getting the patients access to our schedules in real time, which is super successful for us and for the patient and the providers. Same thing with the clinical notes. Clinical notes, providers, you would have to wait for them to write them out in some cases. Now, with it being electronic, as soon as they sign off, they can use the ScriptSender platform to send that order over to us, and then it's put into the patient's folder. So we don't have to manually do that. And then with the cases going directly over to Infinx, you don't have to wait for someone to actually touch that case to start the authorization. Infinx is doing it as soon as they receive that order. So everything's happening at the same time, which is phenomenal.
Yeah, that's awesome. So I'd imagine, the patient experience has improved as well. So how has that transformation affected patient experience specifically, especially for urgent cases?
Yeah, absolutely. I mean, like Tom said, Maryland is very competitive. We have lots of practices out there. With us being able to receive those orders in real time and start the authorization, we're able to see patients faster, which improves, the patient experience. They're happy to be seen. They're happy that their reports are then completed and sent to the doctor as soon as the report is signed through the ScriptSender platform.
Nice. And then Tom, you've seen volumes rise 20% without growing your prior auth team, which is amazing. I mean, that's an amazing stat. What does that say about the ROI to this integration?
Yeah, I mean, I think just radiology in general right now, there's a number of barriers and obstacles from reimbursements decreasing to radiologist challenges to tech shortages. And we're looking to, every practice is looking to find good partners and resources. And I think that's 100% what we found with Infinx, where every practice cannot just keep adding more and more staff. And with the prior authorization challenges, one might think to just keep adding pre-auth staff to kind of adhere to the pre-auth demands. Of being efficient and leveraging kind of AI technology has really helped us kind of limit the additional staff that we would need to add to keep up with the 20% volume. So how can we leverage some of the resources that we have and partner with a company like Infinx and leverage the technology that ScriptSender has? That's how we've been able to do it. Is there an investment in both of them? Sure, but it far outweighs, and the return on the investment is so much greater as opposed to adding 10 more additional pre-auth folks to be able to keep up with the 20% demand. We've been able to kind of rework some of the pre-authorization workflow internally to leverage the Infinx product and the ScriptSender product to just be more efficient. So that we wouldn't have been able to grow 20% in volume without their partnership. And if we didn't leverage them, the financial investment into more employees would have been probably 50% higher in those departments, if not more, to be able to keep up with the demand.
Sorry, go ahead, Kristen.
No, I was going to say when we started out, we were sending around 800 cases to Infinx for prior authorization. We're now at 2,200 cases that we're actually sending over. And, it's still maintaining the same requirements with the turnaround time. So like Tom said, having Infinx is able for us to increase our volume, but also stay true to what we want for our turnaround time for prior auth.
Yeah, and it really takes away from all the manual intervention at that point in time, having clean data that's coming through, right? So at that point, you guys are just grabbing what's needed. It's already coming into the system at that point in time with the collaboration that we have, that you don't need to have somebody, typing in that information, having those missteps that could potentially happen, right? We're all human at that point. So that all happens. So by having some of this automation to be able to get this through the system in a clean way so that you guys can do your work as well to be able to kind of streamline that and push it through is probably, a huge benefit at this point in time too. So what you're saying, going from 800 to 2,200 at that point is enormous compared to what you guys were doing before when you were doing it manually.
Yeah, absolutely. And when those authorizations come back in, the status in our own RIS platform changes so that our prior auth doesn't have to do that. So, the information comes directly from ScriptSender and Infinx and goes into our RIS system that this case is approved. These are, this is the case number, this is the authorization. All of that comes directly into our RIS platform.
So, Kristen, can you share a customization that made a big operational difference that was offered?
Yeah, so both platforms can be customized, which is fantastic because not every facility that they work with is going to do the same workflows. So one piece that we did with ScriptSender was for our web orders specifically. So we want our documents to be able to be modified based on our radiography protocols. Sometimes doctors' offices order cases without contrast and it should be with contrast. So the feature that ScriptSender added for our web order specifically is just a disclaimer on the web order itself. It alerts the provider that is going to be placed on the order, and then it also comes over on the order itself to basically say that whatever the order that you're placing can be modified by Chesapeake Medical Imaging should we need to, based on our protocols.
Yeah,
Nice.
and I think Stuart as well too with that, right? So if there are offices, let's say referring offices are still, not using EMR systems or not having those ordering modules within those, right? Being able to use a web order process that is very easy to kind of walk through to be able to do that so they understand the information, be able to click and get to the specific locations of where those exams can be performed at that point in time as well is I think is very helpful for them. And I think that it helps to kind of get away from those paper scripts, those that are constantly still out there, right? People still have those pads. And, to kind of get away from those pads to be able to give something that's still electronic at that point in time is another added benefit. It's not just using some of the functionality that we have to kind of make it easier within those EMR systems, but also those that don't have the ability to be able to still get something electronically over to CMI at that point to make it a lot faster, to be able to get that patient through the door, to get the patient care at that point in time is really big too.
Yeah, and we have providers that use that platform all the time because they don't have the EMR systems to create those electronic orders, and they love that they can submit it through there, and then they can also watch the prior authorization process on their document management page. So they can see everything that Infinx is doing or what CMI is doing to get that authorization.
Yeah,
Yeah,
statuses are all clear, color coordinated, understood of where everything is happening at that point in time.
a lot of transparency there. That's very important. Absolutely. So, Stephanie, any perspective on what made this implementation stand out to you?
Yeah, I think it goes back to what everyone has said so far, where once the doctor has placed an order, the authorization and the data is going back to the CMI risk system, as well as initiating the pre-auth request. So all in all, it kind of and expedites the prior authorization process and patient care that we can give to the patient. So at the end of the day, just having the patient in mind and delivering that care as quickly as possible, it only increases ROI for CMI as well as the doctor-patient care workflow, and as well as getting the patient the care that they need.
Awesome. So, and it's a question to both Stephanie, yourself, and Jason, basically based on what you've seen with CMI and other clients, what advice would you give practices that know they need to modernize, but are just overwhelmed? They don't know where to start. What's one simple step that teams can take to get started? And I know that I directed this at Jason and Stephanie, but also, Tom and Kristen, y'all can chime in as well. Feel free.
Yeah, I mean, I'll start that. I think seeing is believing, right? I mean, being able to understand that you're in a way that you've been doing for so long, right? Being understanding of seeing an ROI, to be able to understand that, if you go down a platform and use integrations, this is where you can be at this point. Here's where I'm at, right? I've been doing this for so many years at this point in time. I'm having these bottlenecks. I'm having these situations at this point in time. How can I integrate to be able to make sure that I'm doing the best thing for not the patient, but also for the company, for our staff, for everything that's going on at that point in time. So I think that's part of it. I think that, if you are, thinking this as a broad kind of situation, you know what I mean? It's always coming out of, everybody gets very comfortable. You know what I mean? You get comfortable with what you do every single day. But at the same point in time, if you give people chances so that they can show you exactly what it is that maybe you have some of these little deficiencies or whatever's going on, and being able to use solutions that could be able to push you to the next level. This is what we do. You know what I mean? We're here to adhere to you guys. We want to make everybody as successful as possible. We want to make sure that you guys are doing as so well as an organization that everybody can clap about it at the end of the day, right? So I think that's a big attribute for it. I think participation, collaboration, I think all of those things all kind of streamline those processes as well. So, with CMI, for instance, and I'll use them as the given here, and I have to, applaud them for it, especially Tom and his team, having that collaboration and participation to be able to go out to those referrers, to be able to, work with our teams and our customer success teams to be able to understand the product, to be able to be interested in gung-ho on wanting to move forward, to be able to showcase specific things, I think is huge. So I think that's, if you have that kind of mentality moving forward, you will be successful.
And also compare and contrasting. So if you were still in a manual way, you're relying on people, and there are people, there's still going to be, people going out of office, there's going to be emergency, life do happen. However, when you digitalize the process, you're kind of relying on the automations and technology itself. Yes, it does break. However, at least there's going to be some downtime that we can expect and one that's going to be turned around. However, there's going to be a lot more uptime compared to emergency that happens in life. So overall, if you do, look at the bigger picture, it's a little bit more reliable and understanding and doesn't yell back at you. And all in all, look into, the data that you do have, what needs to be, be gathered, and then look through the workflow and then digitalizing that process.
Awesome.
Yeah, two things that I would like to add is, if for potential practices out there looking to potentially make a move and become more modernized, one area that really stands out to me about both of these products is there was never a time where it was, hey, we think you can help, but you need to absolutely kind of scrap your RISPAC system now, or you need to go back to the drawing board before we even start. Both of with Jason and Stephanie, it was, let's take a look and see what you have, and let's customize it around that. And let's help you kind of get from A to B faster without, you know, reinvesting into a completely new program where it's just hundreds of thousands of dollars. So that's one thing I really respect about Jason and Stephanie and their teams as well, is they got to know CMI, they got to know kind of our workflows, and then on the human element side, putting on my sales liaison hat, if you ask any liaison or sales rep what they pride themselves on, the term relationship is going to pop up. It's like, we got to have good relationships. I remember with the birth of some of my kids, like Jason was one of the first people that I texted
Yeah.
pictures of, and Stephanie was texting me pictures a couple weeks ago when she was at a hockey tournament. So, when you think of relationships, there's, whether it's personal or professional, there's going to be good times and there's going to be bad times. And when we had barriers and obstacles to overcome, we know Jason was going to pick up the phone. Working with Stephanie on another project, we know we can provide feedback, and we're going to get through this together. So, I know when we're out in the field, we get more questions about other products because we're there and present. We don't have to wonder where Jason is. We don't have to wonder where Stephanie is. I could call Jason on a Sunday morning, a Friday night, a Monday morning, he's going to pick up the phone. Same with Stephanie. She's a text away, a call away. And not every vendor can say that, and it's not like we've been working with these two groups for a month or two and kind of still in the honeymoon phase. It's been years of working together, collaboration, brainstorming, going through hurdles and obstacles together. And that's where hopefully, this is a sincere, kind of genuine case study, but it's real. It's not fluff, it's not fake. It is what it is.
Yeah, I also want to mention that when you go through integrations or new softwares, you kind of get mixed in between different people. From the beginning of this integration, it was always Jason and Stephanie, and we're still here many years later, and it's still Jason and Stephanie. So that, again, like Tom says, they're always a call away. There's also, like, if we have internal workflows that we're trying to improve, we can reach out to them to say, hey, this is what we're trying to fix. Do you have any solutions or things that you can suggest for us? And they do. So it's been a wonderful relationship. And I said this kind of on our prep call, that it wouldn't be as successful as it is without the team that's in play here. And I couldn't leave this meeting without giving kudos to Tom and the marketing team, because like Jason said, they're out with these referring doctors, and we know with referring doctors, they don't like change. They don't want to do something different.
Right.
So just, constantly being that voice to make this as successful has been huge.
Yeah, and to piggyback off of all of that too, to have a customer like you guys, to be able to have those relationships, like Kristen, you got to understand, you're the glue. You know what I mean? You've been able to really push us as an organization to really think outside the box on aspects as well, which I think is incredible. You know what I mean? Having Tom and his team being able to go out there, like you said, to be able to do what they're doing. I mean, this partnership is a partnership, right? It's not like we're just here being a vendor. We're giving you a solution and that's it. No, we're here to move, to be nimble, to work with you guys, to do whatever's necessary for you guys to be successful, to move forward, right? And that's never going to change. That's our motto. This is what we do. We're here for you guys. So I know that you give vendors the kudos, and thank you for that, with Infinx and us, and because these partnerships that we have are great, but without good customers like you guys, you know what I mean? No one's going to be successful at that point in time. So you guys deserve your kudos as well.
Yeah, well said. Absolutely. Well, Kristen, Tom, Jason, Stephanie, I want to thank all of you for sharing your time, especially your experience. This story is proof that transformation does indeed take years. With the right partners, it can be fast, practical, and high impact, but those long-standing relationships make it consistent, make it compatible for the long haul, because everyone wants you don't want just a quick fix. You want that long haul solution. It's also going to adapt with technology, because technology is always changing. So I really want to thank everyone of you for being a part of this panel. I know your time is precious, so appreciate you taking the time. And I want to thank everyone else for joining us today who registered and is attending as well.
Thank you so much, everyone.
Thanks, everyone.
Thank you.
Bye.
Thank you.
Bye.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at infinix.com. That's infinx.com.